administration's goal here is to reduce addiction to prescription medication as well as illicit drugs like heroin and fentanyl. And the move doesn't come a moment too soon for the thousands of local families who have lost people they love to the opioid crisis.
She wasn't a screw-up. She just needed help.
The most that I miss is his hugs, because when he hugged me, he did it from his heart.
When I was using, I didn't even realize that I had an addiction.
These are just a few of the stories of opioid addicts in the tri-state area and the people who loved and lost them to overdoses.
We can be the generation that ends the opioid epidemic. We can do it.
Today, President Trump declared the opioid epidemic, which claimed more than 64,000 American lives last year, a national public health emergency, making a down payment on one of his first promises in office. The move allows states to shift funds away from other medical issues like HIV and diabetes to provide more opioid treatment.
We will announce a new policy to overcome a restrictive 1970 rule that prevents states from providing care at certain treatment facilities with more than 16 beds for those suffering from drug addiction.
The federal declaration is no surprise to local officials. In 2016, opioid overdoses killed 2,612 people in New York State, half of them in New York City, more than 2,000 in New Jersey, and 917 in Connecticut. But the president's move stops short of declaring the crisis a full-on national emergency, a technicality which would have unlocked millions of FEMA dollars. And some lawmakers say today's news falls short.
Declaring an emergency means he can have access to some funds, but the funds in that account are like $57,000, $58,000. So show me the money.
And President Trump says he hopes to change that, and he will work with Congress to do that and fund the effort. He also says his administration is working closely with health officials to develop new non-addictive pain medications.